don't know if you know, but Devon is the third largest county in England. We cover 2,500 square miles. The distance between Ilfracombe at the top to Dartmouth in the south is 80 miles, and from Tavistock in the west to Axminster in the east is 69 miles, and this is the area we cover. We have the 12th highest population in the country of 767,000, and we are the 7th most sparsely populated. The national picture for isolation is 5%, in Devon it is 23%. So 23% of our population feel isolated. Populations of over 10,000 are defined as urban, and approximately 10 million in our country are rural and 40 million are urban, showing 20% of the population being rural. Of the county's 422 parishes, 97% of that population is less than 10,000. So you can tell that the majority of Devon is made of rural inhabitants, where there's inhabitants. The government's rural statement was published in 2012. Its priorities are economic growth, rural engagement and quality of life. It highlights issues of accessibility, cost and timing, and a lack of systematically organised information of learning opportunities. NIAS carried out a study in 2012. They recommended that more learning opportunities in rural areas can be achieved by partnership collaboration. Research has also revealed additional cost of rural delivery, the viability of low group numbers, and the need for better ICT and for better mapping of rural provision. The research went on to show that new models of delivery are needed in addition to the traditional pattern of weekly group delivery of learning, blended learning and ICT-based models of teaching. Most community learning providers in rural areas are like Learn Devon, run by local authorities. In Devon there are some colleges that support rural areas, such as land-based colleges, like Wellington College as an example. Most providers are finding it hard to finance rural groups because of viability. In some cases the reverse is happening. Urban learners are coming to rural areas with agencies such as the National Trust, who arrange walks, art, traditional crafts and photography. Their target groups though are general and not aimed at specific targeted groups. Distance learning could be offered, but as a service we have tried this, taken this low, broadband inadequate in most cases, and still quite isolating. The Harold Wilson Lifelong Centre on the Isles of Scilly, they worked in partnership with Plymouth Adult Learning Services and have an have used e-learning to deliver Spanish and French language courses. So a group of learners gathered in the main learning room while the tutor teaches from the mainland using a widescreen television equipped with Skype and HD webcam with an omnidirectional microphone. These give a clear image and good sound to make the learners and tutor comfortable, as if they were in a normal face-to-face learning environment. Defra's statistical digest of rural England says that if you live in a rural area and your life expectancy increases and you're less likely to die prematurely from cancer, stroke or heart disease, on average they should live up to 2 years longer. Good news for your physical health, however, those in rural areas have less accessibility to key services such as GPs, hospitals, and experience poverty, isolation and mental illness. Farming has a high suicide rate, and those who do have a mental illness are less likely to seek treatment from those in urban areas. Mind and farming help provide support where they can.